Uh, Today's topic is case history. What is case history? We'll define it as a planned professional conversation that enables the patient to communicate his or her feelings to the clinician so as to obtain and recorded in patient's own words so as to obtain insight into the nature of the patient's illness and his or her attitudes towards them. It's a planned professional conversation between the doctor and the patient, which helps the patient to communicate his fears, symptoms, feelings to the doctor. So it is recorded in patient's own words for the clinician to obtain knowledge about the patient's illness and its attitude. Why do you need to take a dental case history? To obtain a doctor and patient relationship, to get an idea of the mental status and reaction, to modify the method of history taking, to know the living and working environment of the patient. It is also important to diagnose the systemic health on the oral tissues and oral health of other systems, and it helps in diagnosis and treatment planning of the patient. So now you will see the components of dental case history. It is given here. First, you will take the personal information, then the chief complaint stating why the patient has come to the doctor, then the history of his present illness, what is its present what is he facing during its present illness will be recorded in history of present illness. Past dental history. Did the patient undergo any dental treatment before? If yes, then you will write here you have undergone extraction or anything. If no, then you will write no relevant history. Past medical history. If the patient has undergone any operation, any treatment, any pregnancy, if it's a female patient. Drug history, if it's undergoing any medication such as diabetes, hypertension, or any systemic diseases related, drug related to any systemic diseases. Family history, does his family have any problem like related any systemic diseases, any associated disease that are running through the families. Personal and social. Personal history means marital status or any personal habits such as tobacco chewing, pan, or anything, betel nut chewing, smoking can come in personal social history. Then we'll talk about general examination, intraoral, extraoral in the next video. So first in this we'll start the demographic information. Demography is the personal information. This is known as demography. It includes name, age, then sex of the patient, and then address. What is the importance of age? Name is for record, to identify the patient, to greet the patient, and to help to develop a rapport with the patient so that the patient feels comfortable if we call him by his name. It reduces his anxiety. Age, it helps us to categorize the patient as pediatric, adult, or geriatric. It also helps us to find if the patient has any age-related diseases such as at birth, then at your childhood, and at adults. Then sex, child dose, also it helps us to calculate the dosage according to if it's a child. And sex, it has any patient has any sex related diseases, habits that such as hemophilia, OSMF, leukoplegia, more common in males. Females, iron deficiency anemia, and stress related disorders, lichen planus, etc. Address, it helps us to know the socio-economic status of the patient, It helps us to know such certain diseases that are common, endemic diseases, pandemic diseases, and epidemic diseases such as fluorosis is common in drinking water in Chandrapur in Maharashtra and Rajasthan. So thank you. For the next thing, that is chief complaint, HOPI, and in detail about the general examination, will refer in the next video. So for this case history, you can refer Anil Gomes. It is very clearly mentioned. It is a book of oral medicine. It is very with pictures. It will help you to understand case history better.